Stephen. You're welcome to Cedtv Channel.
Thank you very much. It's nice to be here today.
Okay.
And I'm glad. When we talk about cultural stigma around mental health, with Nigeria as a case study, we're talking about the negative attitudes or behaviors that the society or individuals in the society have towards people who have mental health issues or mental health challenges that is influenced by cultural norms and beliefs.
Okay.
So that's a way to capture what cultural stigma around mental health is. So it actually captures ignorance or labeling or stereotypes of people that have mental health challenge that is due to the cultural norms we have in this part of the world. Although it's a global issue, but today we are talking about Nigeria as a case study.
Stigma, how does it relate to the mental health, and how are the people affected? I mean, the people with mental health issues.
Okay. So cultural stigma, it has various ways it manifests or it is expressed towards people who have mental health challenges. One of the ways is that it could be expressed through social rejection or social distance. By that we mean when people or when the society distances themselves or refuses to associate or include these people as every other normal human being. For instance, when it comes to giving them maybe employment or job, or just relating with them, maybe even accepting them to be their neighbor, or to, if they are selling something on the street, to patronize them. That's one way it manifests. Social distance. I don't want to have anything to do with this individual, not because of that person's personality, because the person has mental health problem. So that's one way. It could also be in form of emotional rejection. You understand? Having a kind of negative thoughts or feelings towards such people. You feel that these people, they cannot do much, they cannot amount to much in the society. They cannot, they are not competent. If it is maybe there is a leadership responsibility, there is already a negative bias. Yeah. So this person, I will not vote him. This person that has a mental issue want to come and be my, I beg you, it's not me. So yeah, that is also a way that stigma manifests towards people that have social, that have a mental health challenge. And it could also be in refusing them opportunities. Not that maybe they are not qualified. It's not that they are not qualified, but the fact that they already have a record, or you are aware that they have mental health challenge, you will deny them. Be it employment opportunity, or when they are working already, promoting them as at when due. Say, this person, can just do anyhow. Yeah. Let's just, is it not him? So that's also a way of stigmatizing those people. Wow. Can be a form of discrimination. Yeah. The person is in the bus and he knows that this person has mental issue. I beg go, the bus can be going, I'm not entering. Cannot come and sit with this person to injure me. I beg. So it can be a form of social discrimination. discriminate against those people because they have mental health challenge. So these are some of the ways that stigma can actually manifest towards those that have a mental health challenge. And one, let me just mention this, one that is even more worrisome is that even the individual that is suffering from the mental health challenge can even stigmatize against himself.
Wow.
That's what we call self-stigma. And this manifests in a way that the person is ashamed to either seek for help or continue the help that he or she had already gotten because of the way the society is viewing him or her. Society is discriminating, isolating him, ostracizing him. He now internalizes this and feels that those things that the society is thinking actually is true.
Yes.
I cannot do much. Yes. I'm weak. I'm not cut out for any meaningful thing in life. So, person begins to feel ashamed, isolate himself from people. You know, it even worsens the cycle. So, is that even when people are even trying to make some attempt to come close to him, he's even running away. Wow. Because to him, he feels that he is hopeless. Now begins to have that hopelessness that I am my own, I'm just unfortunate. My life, but let me just live and die. If there are ambitions the person was having before, the thing will just die. If there are dreams or visions the person is having, he said, since this condition, my own is just finished. Let me just manage and go through life. Whenever I die, I die. So that's also another way that stigma manifests towards mental health people. But now, it is the individual himself that is stigmatizing against himself.
Wow.
Get it now?
Yes.
Yeah.
This stigma is really worse than we think it is.
Actually.
Yeah. Okay. So, what are the psychological effects of this stigma? I think you have mentioned something like that.
I mentioned, yes. In that line, one of the psychological effects it will have on the individual himself now is that person feels that his life is unfortunate. Wow. Now develops that feeling of hopelessness in life. And when that develops, he begins to lose interest in things. He doesn't have interest in developing himself again. He feels that he's worthless. That's the word. Exactly. He feels that he's worthless. He isolates himself from other people. He can even begin to have suicidal ideations.
Wow.
If it gets worse in that very line of thought, the person can begin to say, let me just end it. What am I doing again? That everybody has abandoned me, including sometimes even the family can abandon the person.
Yes.
And then families may now begin to say a lot of things. Look at you. Look at your mates. You don't know. Is it only you that is having challenges in life? Yeah. That you now broke down and now you say you are suffering from depression because of stress. Are you the only person that is trying? In fact, you're a weakling. Wow. Nobody has had this kind of thing in our family. Where did you come from? That can cause an individual to have suicidal ideations. That could be the effect. And if care is not taken, it can progress to the actual suicide itself. The person will kill himself or deliberate self-harm. That's another effect. The person will now begin to harm himself. He may not be eating well again. You just say he's not eating, starving himself. He can just take any medications, overdose. If they were giving the person drugs and say take one tablet in the morning, person can now just one day decide to take 5 tablets at once. That's deliberate self-harm. He knows that that thing is going to harm him, but he's doing it because of what? The way he's feeling in himself. Stigma is one of the causes of suicide in people that have mental health problems.
Wow.
And it's usually worse when that stigma is coming from family members.
Yeah.
Because, you know, in our culture, in this setting, there is a lot of social and communal support.
Yes.
People maintain ties with their family members, with their community, extended families, friends, neighbors. In fact, you can, if you live in a place for some time, you can even regard the people living around you as your extended family member because of how close you people have become. And that fosters a kind of emotional support. It gives a kind of emotional support to us that help us to thrive with challenges we're having. Mental health challenge being one of them. So when you go through things and you lose those supports, for instance, if it's somebody that goes to church, nobody is asking after him or her again in church because they feel that we don't know what is happening to him or her. He's now misbehaving. Say he has one mental health problem. The family abandons him. Everybody, he worsens. And the person one day, thoughts can begin to enter his head. So stigma contributes to suicide. I may not say that is the most, or the is what causes most suicide that happen, but is a very strong factor in people that go ahead to commit suicide. Many of them lack support.
Yeah. Wow. Okay, Dr. Abuchi, can you quickly tell us the root cause of mental health issues? Like, you know, when you said someone has malaria, someone has this, you can actually trace it that this person maybe was bitten by a mosquito, or this happened, or there's just a root cause, something spawns it. So what can be the root cause of mental health challenges in individuals?
All right, that's a very good one. So the thing is that mental health problems or mental health illnesses is a wide range of illnesses or conditions.
Okay.
You understand? Aha. So depending on which one we are talking about, we can talk about what could be the cause.
Okay.
For instance, if we are talking about somebody that have alcohol addiction, for instance,
Yes.
which is a mental health problem, it's a psychiatric problem.
Yes.
So in that case, the cause of that manifestations that we are seeing in that alcoholic or alcohol person suffering from alcohol addiction is due to addiction to alcohol.
Wow.
That is the cause that you can trace in that case. Not just alcohol intoxication that I'm talking about,
Okay.
but I'm talking about addiction to it. There are people that are addicted to alcohol, that even when they clearly knows that this is causing problem to them, but they can't stop it on their own. They have this compulsion. So when it has moved from just taking alcohol at your convenience to the point that you are now compelled, even when you don't have money, you don't feel like it, but once the urge to take it comes, the person goes. That compulsive stage is when it has become a mental health problem. So just telling the person, stop this thing now, will not solve the problem. He has reached a level where he needs a mental health healthcare personnel to attend to him in order to treat that problem. The same thing with somebody that have substance misuse or substance addiction. And when we talk about substance, talk about cocaine, marijuana, heroin, methamphetamine, the one that they call ngolomili,
Yes.
and other recreational even tobacco, recreational drugs. So there could be also addiction to them. That is also a mental health problem. So in those instances, the root or the cause is traceable to those substances that those people have abused or misused. There is also a mental health condition we call post-traumatic stress disorder,
Okay.
PTSD. A traumatic event. When an individual encounters a traumatic event, which could be emotional trauma. It may just be that the person lost a loved one or a dear one, or the person was emotionally abused, maybe as a child or teenager. Person was abused emotionally because it became a trauma that lived with the person, that now begins to affect the person's mental function.
Wow.
That the person is not behaving normal again because of a trauma he had, or somebody that was raped.
Okay.
That is a trauma, and that could be a cause of a future mental health problem.
Wow.
It could even be physical trauma. Maybe somebody had a fatal or ghastly accident, motor accident, and whenever he remembers that picture of how the vehicle somersaulted and everything, it just puts the person off. So those are varying ranges of mental health challenges that we can talk about. Then we can also trace mental health illnesses to genetic cause.
Wow.
Some people who are genetically predisposed, that is, it has to do with what they inherited in their gene. Some people are also like that. You cannot say the person misused or abused any drug, cannot say it's trauma, or you just discover that the person is manifesting one form of mental health challenge. That's where sometimes when we talk about in our culture, they say go and inquire whether there is madness in quotes in their lineage. So talking about people who may have a genetic, for one reason or the other, have a genetic predisposition to having mental health problems. So it's a big cause, but a trigger, something triggered it, either an event, a trauma, or whatever can trigger it. Even some pregnant women, after delivery, a few days after their delivery, they will start manifesting
Wow.
some mental health symptoms and signs.
Postnatal.
We call it puerperal psychosis or puerperal blues. Some of them will just become moody, like somebody that have depression after delivery. Some of those could be due to the stress of the pregnancy, the labor,
Childbirth.
and the childbirth that triggered that to happen. After some period, they may get better. You get it? So that's it.
Now, you talked about genetic conditions, and I keep wondering, is there no cause for the genetic condition? Like,
What could make somebody to have a genetic problem that will predispose to mental health issues? Is that what you're saying?
Yes.
Yeah, you know, when we talk about genetic problems, it boils down to what is happening in the micro level, because the way the body functions is that as we are now, there are different processes of formation that is going on in our body at the what we call the cellular level, the lowest aspect of human beings. You are seeing us now, we can be traced to the cellular level. It's the cells that will come together and form what we call tissue. Tissue will come together, form our organs. Organs will come together, form our system. Yeah. You know, say respiratory system and all those. You can trace it down to the cellular level. So at that level, so many things are going, millions of coupling and uncoupling and all those things. So if for one reason or the other there is an error at those level of the coupling, can manifest with a physical condition or a mental condition. Usually the body has a way of recognizing those ones that didn't form well or that is error in. But if it misses the body's radar, there could be a problem that over time will now manifest, depending on which part that will now determine what will be the manifestation as we see. It could be any other physical illness, it could be mental illness. So, but trying to trace, okay, what could be the thing that now cause that problem in the genetic? There are so many other things that can cause it. Some other times you may not even trace. It's just that an error happened. Or there are things that can predispose to something, that error happening. So, but I don't want us to go into genetics in this discussion.
Okay, that was a wonderful one. So, what could media outlets and influencers do to help change the narrative and to curb this mental health stigmatization, cultural stigmatization? What's the role of the media?
The media.
Yes.
Okay. Yeah, the media actually and influencers, like you call them, they have a lot of role to play, because one of the things that fuels cultural stigma is ignorance. You know, ignorance about these mental health illnesses that we're talking about. That is one of the things, in fact, that is the major thing that fuels the stigma. So the media, whether the print media or the social media, could be an avenue of educating the populace on these mental health illnesses, the causes, what should be done for someone who has mental health illness. The media can play a role in educating the populace and in busting the myths. You know, there are myths that are associated with mental health illnesses. Those false information that is spreading around, the media can come in various ways.
False information like?
Yes, false information. Some people believe that, in fact, when you have mental health illness, is a repercussion of the abominations and evil that you have done.
Wow.
That the gods or that God is punishing you. That's why he struck you mad.
Like in the Nigerian movie.
And that's what we see in most of our Nigerian movies. You see somebody that has been killing people in the village by diabolic means. So the karma or the consequence that we'll see towards the end of the movie is that the person ran mad. And that's what many people will assume, that people they see having mental health illness, either depression or psychosis or whatever form of mental illness, is due to the evils they have done. Now they are now reaping the seed or the fruit of the seed that they have sown. So that's not true. So yes, that's a misconception. So those misconceptions that people have, the media can help to educate the people appropriately. It can be through posters, it can be through bringing in experts to talk about this, maybe like what we today, to talk about this and enlighten the people. You can launch campaigns on the media, can launch campaigns on social media or any other media outlets. When it is coming from this social influencer, social media influencers, it will also go a long way because they have a large pool of followers. So when they also come out to say what is right, not that they are just lying, but bringing out the right information to give to people, it will reach several more persons than if they are not the ones doing it. That could be an avenue. Also, can even use even the word, there is a day for celebrating World Mental Health Day.
Okay, yeah.
So the media can also, if it's during that day, it's usually on 10th of October every year, you can launch a program or host a program or seminar on those days and enlighten people. You understand? So that's where the media comes in, and reducing portraying wrong informations too by the media. You know, like we talked about our movies, we should balance the information that we give out, not making people see from our maybe the comedy skits or the movies that this is what causes mental health, or this is what should be the attitude. You know, usually when somebody and that kind of thing, they pursue that person, excommunicate the person from the village, send the person to wherever the person wants to go, which is the wrong thing that should happen to somebody that has mental health challenge.
Okay. Okay, Dr. Abuchi, this is me thinking out aloud. Do you think an average man, despite sensitization and the enlightenment, would really want to associate with someone with mental health challenge?
Okay, so that's where learning, unlearning, and relearning comes in. So when we talk about mental health illness, the typical picture that comes to an average person is that woman or man that is naked, violent, aggressive, carrying broken bottles and lying down by the refuse dump site.
Yes, actually.
Yes, but that's not it. That's like the extreme of what we are talking about. You know, it's just like when you have an injury, maybe you mistakenly cut yourself, and you refuse to go and clean it and treat it, and you leave it to continue to fester, infection will enter it. It may get to a point that the infection would have spread, that they say to treat this, maybe if it was in your leg, that they have to cut off the leg. But when somebody is looking at it, cut off leg because of small, but it wasn't at the level of just cut. It has progressed to the point that it now became chronic.
Okay.
So most of these people that we see on the street, they didn't start like that. One day they just jumped out and went to the dump site or in the market. They started manifesting some subtle symptoms that was not either picked by the people around them, or that they picked it and for one reason or the other ignored. Did not seek help for the person or the individual, or the individual even felt that he should not seek help. He understands that he has a problem, but maybe he's ashamed of seeking help when the thing was still mild, until it became overt, became chronic.
Wow.
That the person has now become the way he is. So for that kind of person, an average person will not want to have anything to do with him or her. But even before it gets to that point, there are people who demonstrate some symptoms. You see people, they just want to be on their own. They no longer put interest in what they used to put interest in. You know that these people, they used to talk, you know, but all of a sudden you now discover that they have now low mood and everything. They are withdrawing from people.
Yes.
Signs that they are having depression. That kind of person should be the person to go close to and encourage the person and say, If this is happening, you don't need to be ashamed. It's not that you are weak. Go and seek help on time so that it won't get bad to the point where everybody is now running away because the person is aggressive or is violent. So that's one message I want to pass across. I may not blame people anyway, because one thing too is that people may not even know the symptoms or the things that are telltale signs that somebody may be having a mental health problem. But that's where media and education also comes in. That part of the things that we can do is to educate people on the symptoms. Like I mentioned, see somebody with low mood, disinterested, is not eating. There's even people that their own mental health manifestation may be like what is desirable. Let me give you an instance. Somebody who have what we call obsessive compulsive disorder. OCD. Obsessive compulsive disorder. That person may just be that his own is that he likes neat environment. He cannot be here. If any single stain is here, he will go and look for something to clean it before. Wow, he will be comfortable. That's a problem. It's an obsession. He cannot do without it. He cannot do any other thing. Like if we are having this discussion now, and I'm the one that is having the problem, and there is something here, I will say, no, stop. Please, bring soap, bring something. He said, no, we'll take care of it later. He said, no, it's disturbing me. I can't concentrate. That's not normal again. Wow. What is this little thing stopping me from doing that? I cannot do it after.
Yes.
So, but it can be a positive thing in a way. You see that person is cleaning the house almost every now and then. You drop anything, you pick it quickly. Doesn't like any dirty thing. That could be an obsession. So, enlightenment on the possible symptoms that when you notice this in somebody or even in your own self, that you should seek help, and where to seek or where to get the help too. That's also where media comes in, to enlighten people, so that before the person goes to that other extreme, people would have identified, at least be able to encourage the person to seek help.
Wow. That's really wonderful, Dr. Abuchi. How accessible is mental health care in Nigeria? And how can we break the barrier? Because from this cultural stigmatization, they want to know the barriers, that
to seeking help.
Yes.
Yeah.
What can actually be done by the healthcare providers
to reduce those barriers?
How can they render help to these people? And how can the barrier be curbed too?
Yeah, actually, there are barriers. One of the barriers is also the paucity of mental health facilities, or where you can get mental health care. It's not in every hospital, not in every general hospital, or even primary health centers that you can get mental health. Sometimes, before you be able to access mental health care facility, maybe in a tertiary hospital.
Wow.
Even you don't even have many private hospitals or clinics that you can access mental health care. It's not like you can always find a maternity center or hospital to go and do your antenatal and deliver. It's not like that.
Well, we have psychiatric doctors, or are they few in Nigeria?
Of course. More so that we're talking about that doctors are generally small or few in Nigeria. Even those that specialize in psychiatry or mental health is even fewer.
Wow.
So that even makes it much more acute. That when you come to even the place where you can access the care, discover that you may be given a long appointment, you may be in a long wait list for your appointment date to reach, or when you come for the clinic, you have to stay and wait for long. Sometimes that may be the case because there are few people available to attend to the
That's right.
numerous number of people. So that's one thing, and that's where the government can come in.
Yes.
Yes, so that mental health care facilities will be much more accessible, even if it is not a teaching hospital per se. Can bring it down to our primary health centers. There are usually primary health centers in communities. If there could be mental health care accessible in those places, it will help to improve access to the people that need it. If some people, when you talk about going to a teaching hospital, they say, "I forget it, I'm not going there." Because some people feel that, the time I'm going to waste there, the time I spend there, the attention they will give me. And some people feel that if your case has gotten to teaching hospital, maybe you are already close to your grave. Your own has become very, very complex. That's also some of the mindset that our people have. But if it is something that they can go to the primary health centers that is very close to the communities where they live, it may be better. And then also, one other barrier too is that even the healthcare professionals also have been found to even stigmatize against the patients.
Yes.
Those mental health ill patients that they take care of. And that may be a reason why some of them may decide not to come again. Or we discourage somebody out there from coming. Say those nurses, they will have you. So those stigma from the healthcare professionals too should also be reduced, because it hinders the patient either from continuing care or from being an agent of spreading the news, of telling other people who may have similar challenge in the community from coming. So also the shame around seeking help. Sometimes people that have mental health and are labeled as being weak, that they are weakling, they are weak in their mind. They cannot withstand strong things. They cannot withstand stress. So that's a label that they put. So effort to reduce those labeling, those stereotyping, will also help to improve access to care of those that are affected.
Okay. So finally, we want to know your message to Nigeria about mental health and how we can overcome these stigmas. And secondly, what would be your advice to someone with a mental health challenge?
Okay. Thank you very much for that question. So first, let me start with the second question. My advice will be that if someone notices any unusual feelings or behaviors that you cannot explain, you should not see it as something you should be ashamed to talk about. Just like if I have a headache today, I should not feel that going to complain that I'm having headache, please, can you look for what is causing this headache and then give me treatment? I shouldn't see it as something to be ashamed of. I'm a human being, for God's sake. The same way my body can be sick, the same way my mind can also be sick. So if for any reason I discover I'm having issues, because even the situation of the country now is enough to even cause someone to have mental health problems.
Yes.
Stress is a very big risk to somebody developing mental health illness. So, and we are going through a lot of stress
And
in
even
the country.
depression.
Yes, all those things. So, if someone you notice, don't be ashamed. Seek for help. Don't go telling people that cannot help you. Go to the hospital. Don't go to spiritual house where they will tell you that it is somebody from your village, it is your mother's grandmother, that your senior, your father, that is what is doing you. Don't go to where they will prophesy for you and say that it is this thing. Or you go to a place where they will tell you should go and do fasting. You know, some people that have mental health problems, they will go and starve them. They will put them in some of these spiritual homes, and they will starve them. And you know, naturally, when you are hungry, you will be weak. So those people that were aggressive and violent, they will now become calm. But immediately you take them home and they start eating again, the problem surfaces again. So they use those things to brainwash people. It is not to spiritual home. If you have a spiritual leader, it can help, it can pray for you, but it should not just end in prayer. As the person is praying, please also go to hospital where you will see a mental health specialist that will look at you. I believe so much in prayers, but I believe also in science. So if God decides to heal you miraculously of your mental health problem, fine and good. He can also decide to use medicine, because the book I read said that the hidden things belong to God, but the ones that he has revealed belong to us. So it is God that have revealed those things to the doctors and nurses. Those knowledge that they have. It's not that you're not having faith if you go to hospital to take care of your mental health issue. So go to hospital as you are praying. Go to the hospital where you'll be taken care of. And don't see yourself as a second-class human being. One thing that happens with those that have mental health is that they don't continue their treatment, and they will relapse. And once they relapse, they will not label it that the thing is not working. Because most of them, you need to be on prolonged drug. It's like they are using the drug to modulate the system. So immediately you take those drugs away, they will relapse. So you need to be consistent. You need to be regular with visits and compliant with the advice of your healthcare practitioners who are taking care of you. Then my message, or the final word I want to give to everyone out there, is that mental health illness does not respect social status or socioeconomic status. It does not respect race. It does not respect age. It affects both the small and the big. It does not respect geographical location. It's everywhere. In fact, there is a report that 1 in 4 people worldwide have one form of mental health illness or the other.
Wow.
So it cuts across. So we should not see it as something esoteric. I'm not praying or cursing that people should have a mental health, but if peradventure you notice anything, either somebody beside you, a neighbor, a family member, the person did not do any abomination. He's just a victim of illness, just like somebody can have malaria. So what should be done is to support the individual as much as you can and encourage the person, because the person is going through a lot. You don't need to weigh the person down more by attitude or by the things that you say. But as much as possible, form support around those people and then see how to pull them through that challenge.
Wow.
Thank you very much.
Wow, that's really a very wonderful session with you, Dr. Abuchi. And we've come to the end of this session with Dr. Abuchi. It was really a scintillating one.